Right. Hello, everybody. Thank you for joining us on this beautiful Friday. Welcome to the North Carolina Traumatic Brain Injury Waiver Overview that is presented today by John, I'm going to say it right, Giampaolo, and Nancy Kent. They are both with Alliance Health, and Alliance is the managed care organization, or MCO, that serves Cumberland, Durham, Johnston, Orange, Mecklenburg, and Wake counties. Did I miss one?
I think you got them there.
I think I got them all. Okay, great. And today they're going to be talking about the traumatic brain injury waiver that is currently available in these counties. There are plans to expand this waiver into other counties in North Carolina. However, the specifics on that, including the timeline, is not clear just yet. So if you are not living in one of these counties, we're really glad you're here because it could be coming to a county near you in the next couple of years. I want to let everyone know that I am going to send a follow-up email. My goal is for this afternoon, but if you don't get it today, you'll definitely get it by Monday, a follow-up email that will include a link to the recording of this webinar. It will include a PDF of the slides. And if there's any other information that John and Nancy want to share with you, I'll include that as well in the follow-up information. We really hope you have a bunch of questions. We love questions, and that's how people learn. If you have questions, if you'll look at the bottom menu, you'll see a Q&A and a chat and some other things. I have a lot more things at the bottom that you guys probably do, but if you'll please put questions in the Q&A, and that's so we can keep track of them and so they don't get lost. In the chat, you're welcome to use for comments, or if you want to say hi and tell us where you're from. But if you have an actual question, please put it in the Q&A, and we have plenty of time to answer questions towards the end. So with that, John and Nancy, I'm going to turn it over to you. Thanks for joining us today.
Okay, great. Thanks so much, Christy. Good morning, everyone. Again, thanks so much for taking the time this morning and to be a part of this presentation. Again, my name is John Giampaolo, and I'm a community engagement specialist with Alliance Health. I work specifically in Mecklenburg County, but I'm also part of the community health and well-being team of Alliance Health, and I have the pleasure of being joined today by my colleague Nancy Kent. Nancy, would you like to say hello?
Hi, I'm Nancy Kent. I'm one of the supervisors for the member and recipient services, so the call center at Alliance, and have been working within IDD and TBI with Alliance for the past 11 years now.
Great. Okay, so we're going to get started, and again, thank you for your time. Let me just get this. So I know Christy mentioned a little bit about Alliance, but just to kind of give you a little bit more information. Again, we are currently a behavioral health managed care organization in North Carolina for 6 counties. As you can see, it's Cumberland, Durham, Johnston, Orange, Mecklenburg, and Wake counties. Our population for Medicaid recipients is around 105,000 individuals, but we have a total population a little over 3 million. We are currently the largest managed care organization by population in the state, not by geography. And you can see at the bottom here, just to have a perspective of our location in the state. We have Mecklenburg and Orange that actually joined the Alliance family back in December of 2021. So again, we're now at 6 counties with 105,000 folks with Medicaid that we're serving. At Alliance, just to briefly mention our mission and vision. Our mission is to improve the health and well-being of the people we serve by ensuring highly effective community-based support and care. And our vision is to be a leader in transforming delivery of whole person care in the public sector that shapes our way we conduct our business. We are, we take great pride in our values at Alliance. We look at a spectrum of areas, including accountability, integrity. We want to maintain our commitments to our community and have transparency, continuity, consistency in what we do. Again, this work does involve so much compassion and, just the care of what we do. So we're driven by that and serving individuals and the importance it is for them. And with that, of course, we value dignity and respect. We do value the differences of individuals. We honor cultural differences in our communities. Collaboration is a key component as well, certainly within the role that I play in community health and well-being, to work with partnerships and develop those partnerships are so key in having a functional relationship within the community. And again, being innovative and having innovation in the way that we do things and how we proceed in doing things. So we always are looking for furthering our strides in what we do in the work that we do in the state. Oops. We are a managed care organization and also known as a local management entity. So of course, there's a lot of acronyms that are used. So we just want to make sure that everybody's comfortable with the concept of MCO and LME. We are not a service provider. We want to make sure everybody understands that we are a health plan. So being that we're a health plan, we manage a network of providers that actually deliver the services and treatment for individuals with mental illness, substance use disorders, intellectual and developmental disabilities, and also traumatic brain injury, which we're going to talk about today. So again, we are a health plan. And I will mention too, just to differentiate the two in case there's clarity needed, managed care organization, the MCO portion, we manage the Medicaid benefits that individuals have Medicaid, where local management entity is more individuals that have or qualify for state funds. Our focus is helping those that are uninsured, underinsured, and Medicaid beneficiaries. Our primary population, our largest population, are those that do have Medicaid, but we certainly have resources available for individuals that are uninsured and underinsured as well. And we already mentioned a little bit about what our counties are, but just to be specific as it relates to the TBI waiver and the onset of that, Nancy's going to talk more about that timeline, but we'll mention to you that Wake, Johnston, Durham, and Cumberland were the initial 4 counties that received the waiver and have been operating the waiver. Orange County, as well as Mecklenburg, were approved by the Center for Medicaid Medicare Services on April 1st of this year. And the launch live date for service delivery took place effective June 1st. So now as we are here today, all 6 counties of Alliance Health are active, offering the TBI waiver services for those that meet eligibility, which we'll talk about here today in this presentation. So how do you contact Alliance? We have a customer service number, which is we call our member and recipient service line, which operates, as you can see, from Monday through Saturday operating hours from 7 a.m. to 6 p.m. And our number is 800-510-9132. Again, just for a point of clarification, that term member would be individuals with Medicaid, and recipient is referring to individuals that would be more eligible for state funds. That is our customer service number. That would be equivalent to the number on your insurance cards that you would call. So again, that's how you would reach Alliance to inquire about services and get connected to one of our Access staff members. We do also operate a behavioral health crisis line, which is operational 24 hours a day, 7 days a week. And our number is 877-223-4617. Just so you know that all of the managed care organizations in the state do have their own separate behavioral health crisis line. This particular behavioral health crisis line is specific to the Alliance counties that we serve. And we just want to stress to you on this that all individuals, regardless if they're members or recipients of Alliance, they are all welcome to call the behavioral health crisis line. It's available for all of our community to ensure that they have an access point to services in times of crisis. And it could be during a call to the crisis line if it's needed, that our crisis call center staff are available to help an individual get connected to mobile crisis services and other resources that can assist them with that circumstance. Again, 24 hours a day, 7 days a week, we wanted you to know that we're available to serve your needs. We do have mention of the nurse line, but I will, just to tell you that that was consistent with the launch of what's known as the tailored plan, which is the state's next move towards the concept of integrated healthcare with both offering the physical health as well as behavioral health. That is the next leg of the journey, but right now that concept, the tailored plan, has been put on hold for the time being. So as of right now, all of the MCOs will be operating with providing oversight to behavioral health only. The nurse line will take place approximately 1 month prior to the actual launch date of the tailored plan. Unfortunately, we do not have any specifics or knowledge of when that will be. So for right now, just to mention that to you so you have some clarity. And we do have our website for the tailored plan, which you could also then have access from that point to the Alliance website itself, and also the TBI portion of the website as well. You can locate through that as well. So again, just to provide some clarification, how we are available and how we can be reached. So we're going to be talking about today the following areas that we're going to be discussing, and we hope that you get better clarity. We want you to help you understand, what is a traumatic brain injury or a TBI? And very importantly, what are the supports offered in the TBI waiver? And we're going to go into those services, the array of services that are offered. Also, what is the eligibility to have a slot, to receive a waiver slot? We're going to talk specifically of what that would look like. And then we're going to explore other local supports and resources. We know there's individuals that may be on the call today that are not within the Alliance 6-county area, but it's important, some of those resources, that they also provide a lot of great information and connections that could be helpful when trying to reach out and help individuals that may have a TBI and trying to gain access to services and resources. So what is a TBI? And, the definition that that Alliance is utilizing as far as, this waiver, it is a change in brain function caused by an external outside force. Could also be looked at as direct impact or blunt force trauma to the head specifically. So again, it is head trauma, direct impact trauma. And Nancy will touch on an acquired brain injury and the dynamics behind that, but we want to make sure that everyone is clear that this is specific to a TBI, head force blunt trauma. Just for from statistical purposes and understanding some of the, parameters of individuals that may receive a TBI, that the top 3 causes are falls, car accidents, and firearms, specifically guns. Sports or head injuries, such as domestic violence or abuse, shaken baby syndrome can also be a TBI. Our presentation today is focused on the adult population, as we're going to get into the specifics of eligibility. But and the specifics of that would be someone that receives a TBI on their 18th birthday or thereafter. But there are resources available for those individuals that may receive a TBI prior that would be more affiliated with what we call the innovations waiver. Nancy and I can be available to provide more specifics, but again, this particular training is not geared towards that, but I just want to mention that if that is a circumstance, that there are other pathways that we can take that could address those needs of those individuals. Again, just some information, the individuals that are most likely to have TBIs are the elderly and young adults. And, one could speculate that for the elderly, it's because of just their stability, circumstances, things of that nature, a risk of falls, things of that nature. Young adults as well, typically could be individuals that are a little bit more risk-taking behaviors that could lead to circumstances to get a TBI. So again, anyone can, be susceptible to getting a TBI, but these are the groups that tend to be the most prone to do so. And those that have a TBI or have received a TBI are more likely to have another. So again, this is just some information to be aware of, just for purposes of knowledge. Again, just to have a visual, you can see, these are 2018 statistics, mind you, but falls, of course, are at the top of that category. And then you have areas of car accidents, assault, hit to the head, and then, of course, causes not known as well. So just giving you kind of a perspective of where those TBIs are taking place. So again, this concept of the iceberg and the tip of the iceberg is used in different analogies, but when you think about it from a traumatic brain injury perspective, and you see an individual that on the surface, everything might look just fine. There may not be any acknowledgement that there is a circumstance with that individual just by looking at them. But what you may not see are things that are associated here. And just to name a few of those items, just processing information, individuals, changes in their personality that might be noted, or fatigue, sleep issues. All these things can be things that are underlying factors that are impacting that individual in their day-to-day function. So again, what we see on the surface is not always what is really occurring. So again, that's why we're really excited to share this information, as there are resources available for individuals that could benefit from them. So again, we're going to hear more about that from Nancy in just a little bit here. And that's, I guess, the cue for Nancy. So Nancy's going to talk more about the TBI waiver program. And so I'm going to hand the reins over to you, Nancy, to take it from here.
John.
A little bit.
No, great information. I appreciate it. Specific to the traumatic brain injury waiver program. Go ahead. So just a little bit of the background for some context. This has been years in development, other states that have brought on TBI waiver services. And I was part of the early stages with Alliance as this was coming around. But this has been 20 years of work trying to bring this about. 2016, there was some funding that was brought around. Things were being developed. We finally got the initial approval back in 2018. Got that renewed. I know there's a lot of concern for other counties. And, as I've had to adjust to, sometimes the system takes longer than what even what the need is, or how most of us want it to move. So we are working towards that. The state is working towards that, but it does come in phases. It's a lot of the foundation behind that. So but we did get renewed, and they did add on Orange and Mecklenburg. So that's definitely showing the positive impact and the need across the state. So very good for all the advocacy work that's been done from everyone. So some of the goals, to go over what really is the goal of the TBI waiver. All the services and the supports are there to help in areas of where does the person want to live, where they want to work, if that's their choice, how you really spend your daily life, not any different than any of us are choosing. And so it is there to support them in making those choices as independently as possible. So who is the waiver for? The waiver is specifically for someone who has had a brain injury on or after their 18th birthday. We mentioned that it's in specifically our counties, Wake, Durham, Johnston, and Cumberland. And then we've added on Orange and Mecklenburg. We'll talk more about some of the other, what that means, but it is on or after their 18th birthday. So these are injuries as an adult, not that the person had an injury and is now an adult. If it's happened as a child, that can go towards the developmental services, which I'm also involved with, and we can always discuss at a later time. So there's a couple different criteria. Again, feel free, with following up later. There's people who can explain it. You'll also have my contact information. I mentioned, I'm going to go kind of a little out of order because I did mention that it has to be diagnosed on or after their 18th birthday. Now, in this, the traumatic brain injury is specifically referring to a blunt force trauma injury. That means something has physically impacted the brain. And we'll go into some of the other areas, but that is very specific that this is impact to the brain. They must also qualify for Medicaid. The waivers are Medicaid funded. The difference in the TBI waiver is that there is a higher income limit for Medicaid. They've increased it to 300% of the poverty level. The reason being that as an adult, a lot of the folks have work histories, and so they may be above the Medicaid limit. So this is a higher level than getting standard Medicaid. However, that is for the waiver program, not simply for having the diagnosis. So that would have to come through the process of looking at that waiver. So we have how and when that injury occurred. We have the financial eligibility for Medicaid. And then the last piece is that the waivers are really meant for folks to keep them in the community because of their injuries or their needs. So the level of care for the injury must meet at least a skilled nursing or an acute rehab, which would be higher than the neuro rehab level. What that means is these are individuals who need licensed professional rehab services, nursing, physical and occupational therapy, speech therapy, cognitive rehab. These are really rehabilitation services. So it's getting back the skills that were lost by the injury. So not everyone who has a traumatic brain injury, even if they meet that age, may not qualify. However, I still encourage everybody to reach out. I'm not the one that determines this. No one is going to be kind of blocked when they call. There's a lot of resources, a lot of other information that we can discuss, that I can discuss. We have information that gets sent out. So don't fear that it's not severe enough or the age isn't just perfect. There are things that we can direct you to. So I just want to make sure that's clear. Here it breaks down the types of eligibility a little bit more. The financial eligibility, qualifying for Medicaid. Sometimes folks have, and we don't do the Medicaid qualification, that is DSS, they manage that. So that we help work along. We help do that application if somebody hasn't done, because also in doing those applications, if they're going through the waiver, that's how DSS would get that information that they can go towards that higher level of income. So a lot of folks that express interest may not have qualified previously for Medicaid. So we did work on that. Initially, we didn't have the higher income. And that's helped out several individuals that wouldn't have qualified otherwise. The diagnostic area is the traumatic brain injury on or after their 18th birthday. That documentation there has to be some medical verification. So there should be either hospital reports. I know questions come up with what if those didn't happen, if someone didn't seek hospital care. There are evaluations that can help coordinate and get those updated, because there would have to be that certain diagnosis validation and such. That's all that we can try to help with, gathering those documents or figuring how do we justify and show that injury and the level of need. Speaking of that level, that is skilled nursing. The higher level is a neurobehavioral level. So skilled nursing can be even some physical needs with daily care. The acute rehab or the neurobehavioral tends to be a lot more of the behavioral issues, sometimes safety issues. So that's something that would all get determined. The main point is waivers in general are always have an equivalent to some facility level of care. That just means that waiver is meant, instead of someone being in a hospital or a skilled nursing, that those services are presented in the community and in their home if that's safe to do so. So they're meant for people who would otherwise have to get these services in the facility, not tending to be mild injuries, but there's still supports and we still need help when things happen like that. So we're here to do that. So I mentioned about the blunt force trauma being the reason. There are some things that are not covered, and those are referred to a lot of times as acquired brain injuries. They're all traumatic. Traumatic brain injury is a little misleading, but acquired brain injuries are more internal, organic, not getting enough oxygen. That could be from even an overdose, a stroke, other types of poison toxins, pressure from a brain tumor. When it gets into specifics, again, that's not for myself or the member services people to determine. They're getting out the information. We would then hand that over and someone would help through that process to see who qualifies. Right now, we're just really trying to get the information out and educate folks on the injury itself a little, as well as what could be out there to help regardless of the level of need. So we have some tools that we can kind of unpack. Go ahead, John. And we'll talk about some of the different services that are available. So this kind of lists what happens within that waiver, what might be needed. What happens is there is a plan developed and working with that person to see, and a care coordinator, a care manager, what types of services make sense for that person, depending on their living situation, what their goals are. It could be day programs, day health, life skills training, like independent living, day supports, people coming in to support, whether it's that person or even a caregiver through respite. Other types of residential options and supports that might be needed. Crisis services, supported living, resource facilitation can be helping to find other things in the community to get connected to. Getting healthy, going to a gym, going to different types of classes, education, all those things, and helping finding what would be additional supports for the person and the family. Employment, natural support, so the family and friends that are around. Sometimes, this can cause a traumatic brain injury, can cause some real behavior changes, or at least mood changes in the adjustment. That can be tough on family members. Being a caregiver is very difficult in a lot of circumstances. So having them get educated, having them have supports, it's not all just around that member and that patient, so to speak. The whole family or the whole setting kind of needs that. Personal care, helping to take care of daily needs, hygiene, showering, bathing, dressing, cognitive rehab, we mentioned speech, occupational. So it really is a continuum of services that helps bring an individualized plan to that person. So let's look a little more specifically at how these get applied. So services that work more towards where you live, that life skills training and in-home supports helps increase that independence. The personal care, residential support, having someone come in, whether that's for other types of residential support in home settings or coming in to do those daily living skills. Supported living, there are some things in development and some partnerships that they can live in their own home, even technology that comes in ways for safety. Respite care, so the caregivers can actually have that break that's well-deserved. And other remote supports, like we had mentioned about video observation. I know I have used that in different supported settings, even in elderly settings, that can be really helpful so that you help someone be independent, but you at least have kind of a safety net there. How you spend your day. All of us want to have a productive and meaningful day. Supported employment, if that's what the person chooses. Day supports or adult day health, where there's a structured program. There may be more day supports as far as learning those skills back. How to keep their schedule, how to maintain appointments, how certain communication and advocating for themselves. So there's a lot in ways of that way, and the person can be involved and the family as much as they choose. How you access the community. I mentioned about resource facilitation, having somebody who can help you find those things that you want. Community networking, connecting to those other meaningful activities that just happen in the community. It doesn't necessarily have to be a disability program. A lot of times we think of like group trips, and that's something that may be appropriate in certain settings, but individually, when I need to go to the store or I go to a class, I'm not necessarily doing it with a very large group, maybe 1 or 2 people. So we try to really normalize the day and follow that person's interest and lifestyle and reconnect them. Community integration and just natural supports, I really believe having people that are invested in your life are a huge benefit and a huge value to us and to the folks that we serve. Accessing the environment, sometimes that needs assistance, assistive technology, equipment, mobility equipment. It might be making some alterations to a vehicle or the home so that it's safer and more adaptable. If someone's in a wheelchair, they may need wider doorways, or they may need to have an adaptable van. So all of those things can be discussed. There are certain parameters and funding limits for different periods of time, but all of those specifics can be discussed as far as what the person's needs are. And then opportunities for growth. When an injury like this or an illness happens that creates some type of a disability or limit, it doesn't mean that it's over. And it doesn't mean that there's not still growth. So that's for the family as well as that person. Consultative services. So we have people in mental health and these other professions that can help advance, not just gain back, but keep growing. Other clinical services, cognitive rehab, those things that help grow for the future and help continue to advance in whatever the area that person does. It doesn't mean that that injury happens and everything is done and just stops at that point. We want to see people continuing to reach their full potential, whatever that might be. And then looking to the future, I had mentioned about, not everyone qualifies for that waiver, but there are other supports. We have been depending prior to the waiver, and as we were growing with Mecklenburg and Orange, some TBI state funds outside of Medicaid to bridge some gaps for people. Advocacy continues to increase those fundings and that importance and awareness of this need. There's a much bigger statewide emphasis of TBI as a unique population. As I have been here, it used to fall under the intellectual and developmental disability funding and service line. That wasn't really accurate. And so now things have been separate, and there is a more specified group of services and supports and specialties and certifications that people have gone through to really understand this diagnosis and be able to help appropriately and not just be grouped together without it being really specific to that person. Again, we had that approval in May of 2008. We got renewed on 2022. I keep forgetting how time flies. And now bringing on in 2023, we were able to start those additional counties. So things are moving forward. So what happens when I call in? You call into the member services, that's my department. That's where, that's my billboard number. Staff, if it's talking about a case, if it's someone that we're trying to do that, then consent for that person is really important. If it's the provider and they've done that, great. Or the family member, a lot of times we'll bring someone on. To get information, that can go to anyone. So if you're just looking about the waiver and about the resources, that's not necessarily starting an individual through the waiver. So it really depends on what the question is. You can always reach me or staff that I have there. When they are calling up specifically about TBI, they're going to ask a few questions. How old was the person when it happened? Or when it happened, what year? How it happened? Was it a blunt force trauma? And specifically, I know John brought up some of the stats. What I have seen more typically in the people coming through have been more of the assaults or hits to the head and accidents a lot of times. So it's a variety of reasons, but we can discuss that and get some resources. They'll also try to see if we know if the person was unconscious, tends to lead a little bit into the severity. And that really helps us gather information that we send to the state, not specific to people, but just the data to help justify of this is how many people are calling in, and this is where we get those, one of the ways that we get those stats to help support more funding. So I do encourage you to call in and chat. We send out information to you. They'll get an email typically, they can send that out. Members that call in, they're put on an interest registry. So there isn't a wait list. They're really coming in to be screened further. They get initial outreach from the care management team to do a little deeper into the information. When you first call into the call center, we're really just initiating that. So we're letting care management know if there's an individual that's interested. Otherwise, we're sending information. But when we hand that over, they're the ones that will do a further screening and find out if you don't qualify, what else might be helpful for you, what other supports, what other TBI funds or programs, and we'll go into some other resources. So community resources beyond Alliance, and some of the things that are sent out in a packet. We have a resource packet that goes out. So we do have some other things and partnerships that we work with. Brain Injury Association North Carolina has been a huge partner throughout this process. They are statewide. And so they are a great resource, website, staff that can help you connect regardless whether you're in Alliance's catchment area or another MCO. Or even folks that are moving to North Carolina and just want to be educated as to what's here. I've seen lists of medical professionals, other partnerships that they have. So we always try to mention that. They also have free trainings that you can find on their website for professionals as well as families, having to do with primary care, transportation, substance abuse. The traumatic brain injury, you know, it may be a very specific diagnosis, but as John mentioned in the slide for the tip of the iceberg, there's a lot of things that are happening underneath that we don't necessarily see. You know, it can be a very invisible type of disability. And so, you know, that empathy and that learning what that might be for that person. A concussion is technically a traumatic brain injury. It may be mild, there's a big spectrum of that. But also people experience these very individually. And so one person with a traumatic brain injury may have very different symptoms than someone else. One may have much more physical need, one may be much more towards mental health and behavior. So these kinds of things are really great for education for any family member, any individual with a TBI, or any professionals that are working or interested in learning more. Gateway Clubhouse is a partner we have in Raleigh. They work not only with traumatic brain injuries, I know they also have served people with acquired brain injuries, but it is a member-run clubhouse. The individuals who attend there keep everything going. They complete the jobs that need to get done. They decide kind of who fits in and what they do for their day and their program or their outings. It's a wonderful resource for that community. I would encourage, if you're close to there, look into that and see if that's an option. Community Partnerships is another close partner with us. They do some case management services that happens across our counties. And that is also included in the information when you call member services. Their case management, I have a flyer in there that I've included to give that information, just to help really get those connections, get that information, and anything else that might be helpful. Pine Sweet Farm is a residential and day program that's out in Huntersville. They are really trying to, as it says, maximize the post-injury potential, get people recovered as much as possible from their injury, and help them to grow and live a full life. Some statewide TBI and basically other disability types of resources. These are not specific to TBI. CAP DA, as I mentioned, there are different waivers in the state. DA, the CAP, it stands for a Community Alternative Program. Some folks are familiar what used to be CAP MRDD, or the old CAP that is now Innovations. So DA is just disabled adults. This is a CNA level type waiver for more physical disabilities. This is not run by us, and it is not specific to TBI. But this is a resource if there are individuals who are needing some supports who meet their criteria, can get some in-home supports, also some day supports for some structured day. So that's something we try to share. Special assistance in-home funding is for adults, and funding from DSS to help remain in the community. That is some of the funding that is used when someone is in a group home to help bridge that funding cost. It's also used to help support some of the programming that happens for adults in the community. So that would be a contact with DSS, and all of these are included in resources that we send out. Medicaid personal care, that is usually a referral from the doctor, and it is someone to come in and help with the activities of daily living, showering, bathing, dressing, but someone to come in who do that. So the doctor can make that referral and someone come out to see if that's something you qualify. So these are things outside of us, but just other helpful things that might be of support to people. Other local resources, Community Partnerships also has a brain injury support program. These are things that are on the TBI resource list. Triangle aphasia for people who have either expressive or receptive speech and understanding issues. Wake Med has a club reach that's specific for brain injuries. Assistive Technology Center is available even to do demos, and they have a lending program, I believe, to see if something is helpful. And vocational rehabilitation is state and federal employment support. So here are some other things. If there's any other, follow-up about that, will also be available afterwards. But these are just some things that you can look into now or at any time, regardless of the waiver.
Okay, well, thanks so much, Nancy. I'm gonna just finish us off here with the presentation. So we just wanted to bring some knowledge to you regarding some other Alliance tools and resources that are available. So just want to share a couple of those. We do have an Alliance Health free screening that's available on our website if you'd like to check that out. And you would have to go to the alliancehealthplan.org website page, and this would be found under our members tab. And then you would go under member services, and there's a drop down where it would be a screening option. So you can click on that and you could take this screening. It is not considered to be, diagnostic. It's just to be able to provide some suggestion as far as, that person would need maybe or benefit for some added assistance. So again, it's available. And this is just some of the things that an individual would utilize when completing that survey. And it would just tell you kind of how to go about doing so. And that, again, we're going to send this PDF out, so you'll have the opportunity to explore this if this is something of interest to you. Just briefly wanted to tell you about community health and well-being at Alliance Health. Each of the MCOs have probably a comparable department that is actually very community-based. At Alliance Health, we do operate off a system of care concept, and the importance of collaboration and developing relationships with community partners, which is so key to us, and looking at things such as social determinants of health and how can Alliance be involved with that to make impact. Alliance is going to be moving forward on an initiative associated with food insecurities in two of our counties. So we really, as a community health and well-being department, are really involved within different aspects of our community. We always tell folks that we're kind of the face of Alliance out in the community. So we're involved with all the different types of health fairs and different events in the community, and developing those partnerships with all the key stakeholders, because it's important that they're aware of these resources. As today is so important for folks to be aware of this waiver. We're out there just basically getting the word out. So again, I'm proud to be a part of the community health and well-being team. This is, you know, at your leisure, of course, you're going to get the PDF of this, but this is, if you wanted to scan this now, you could. This is our 2022 annual report. You can kind of see what has been taking place with Alliance and just get a perspective of where we're at and where we're heading. You'll hear from our CEO, Rob Robinson, who will probably have certainly an address made in that report. So certainly encourage you to take time to look at that if that is of interest to you. And that really ties us up for the end of our presentation to you today. And we are now able to take questions and hear from what you might have, comments you have, or questions you may have regarding what was presented.
Fantastic. Thank you guys so much. That was fantastic information, and the resource section was amazing as well. Thank you so much for putting that together, both of you. We are going to jump in to answer some questions. Before we do that, I would like to launch a real quick evaluation poll. It says it's 6 questions. I want to say it's less than that. If you will just fill that out really quick for us. If you are on a mobile device, it may or may not pop up. But we really appreciate it if you just take a quick second. ECAC is largely funded by grants, and our funders definitely like to know that the information that we support in getting out to families is useful, relevant, and high quality. So if you could just take a quick sec to answer that, I'd appreciate it. We can move forward with questions if you guys are ready. Some of these may have been answered already in your presentation, and that's why we typically don't stop the presenters to interrupt to get questions answered, because oftentimes that information is answered as they go along. First question is, are strokes considered a TBI? Memory and IDD are involved in our case.
And as I mentioned, that it would have to be, and I know I saw a couple later, it would have to be blunt force trauma as far as the TBI waiver. There are other resources as far as acquired brain injuries, but the waiver itself is blunt force trauma. So a stroke or a loss of oxygen, as I saw from someone, would not qualify as a diagnosis.
Thank you, Nancy. Let's see. We have a question from Program Manager for Alliance of Disability Advocates. My question is, how do you see this TBI waiver assisting individuals that are incarcerated or currently on post-release with an IDD and or a TBI diagnosis?
I think it would be the same. I've had folks call in and get connected who have had injuries while incarcerated. And that was the reasons, you know, for a variety of things. So I haven't seen any limits as that. We need to get them connected and see if they and go through the same process, see if they qualify by the injury and by their level of need. And otherwise we would redirect to other supports and resources.
Great, thank you.
I did see that someone had just mentioned about because of IDD and memory being in the other one, the IDD services, if that's what it is, that they can also follow up with me, as I mentioned in the chat. But that would be towards the innovations waiver. It wouldn't be the TBI waiver.
Next question, how many individuals are currently on the TBI waiver?
I don't have the exact number. I don't keep the active list of members. I'm really getting them handed over as far as the interest. So I don't believe they have the active number on the website. I'd have to follow up and see what that is. Which I can do right now while we're talking.
I believe you answered this as well. Are brain tumors and exposure to drugs considered a TBI? And that's an acquired brain injury, correct?
I
Okay.
will say that, when it's a brain tumor, the tumor itself, but if there's something that happened during surgery or, I can't say that there was not a tumor and a fall or a stroke and a fall. A lot of times there are multiple reasons. So, I would encourage people to call and don't assume that they're not going to qualify, because I'm not here to block folks. I'm here to get information out. And so I'm always happy to talk. So I don't want someone not to call and say, oh, it's a stroke. We will. Please call in and just talk anyway.
That's a good point. People who have strokes do fall, and fall could have caused some of the injury. Okay, that's a very good point. Next question is, what steps are actually being taken to spread the waiver statewide, and by who?
Across the state, we have a advisory meetings with different advocacy. We have meetings with the state. It's been an ongoing process to try to increase that. But there are different pieces involved. So it's not something that I am involved as far as the policy level, but there is a team at the state that is specific for the TBI waiver and for expanding those services.
Yeah, so that's an NC Medicaid thing, not necessarily the MCOs having anything to do with that.
But all the people that we talk to and that I track and I submit in and all of that information, the more calls we have about what these injuries and how they're being caused also helps us do education prevention. I will tell you that that's one of the reasons that when the waiver started, it was from at or above 22, because if it happened prior to 22, it falls under the developmental disability age. Except that there's a lot that happens between 18 and 22, especially with traumatic brain injuries. John brought up about the youth, kind of that transition age. A lot happens, impulsive, a lot of accidents. So the waiver was dropped from 22 to 18 based on the information and the reports that we were getting. So that's why I would absolutely encourage, sharing that. Don't not call in because they're 18 and you're not sure. We can figure that out and just call and ask.
Great point. Next question, is the Rancho Los Amigos scale being used to determine eligibility? If so, what score must you have to qualify?
I would love to answer that. It's not my role, so I'm not sure what they are using. I know that they're looking at different levels of care. They're doing with this with with neuropsych, but how they specifically, what the scales are, I'm sorry, it's not something that I'm involved with. That would be more the medical team and the doctors they're working with.
Okay, next
And
question.
Christy, I can try to follow up. I'm trying to keep a note on what the questions are, and I can follow up with you later.
Okay, that's perfect. Yeah, and again, the follow-up email probably will not go out today, to be completely honest. I'll probably do it Monday, so that gives you a little time if you want to find out a couple of things. And if not, we can always send a follow-up to the follow-up. So that's fine too. Thank you. Appreciate that. Next question is, the services, is the community already built up to support those on the TBI waiver without being on months to years wait list, waiting, etc.?
Yes. So and I think a lot of times that's referring to the long wait list of the other waivers. It's a different setup. The TBI doesn't have a wait list, so it continues to expand. So that provider, it's not that it's done and it doesn't change. Those services continue to expand and enhance. But yes, they are there to provide services. I know that across industries, staffing has been an issue, regardless of what industry we work in, healthcare, retail. So that's something that's a little beyond our control, but I know our providers consistently are hiring and training and enhancing their staff and the certifications and the education. So those provider network is there though.
Perfect. Thank you. Next question, what needs to happen to make the TBI waiver available in additional counties?
Advocate for the need. Keep calling in and giving us that data. But in our case, all we're able to serve, even though we're advocating across the state, we're only able to serve our counties.
Right.
we're a contract with the state. We're not the ones determining the expansion. So I would advocate with the state for additional funding and additional supports in those counties.
And I was poking around, I overread, so I confuse myself sometimes, but I was poking around yesterday and did see that, don't know if it was NC Medicaid, if it was the North Carolina Brain Injury Association, or I could be wrong on both of those, but they were collecting data on instances of traumatic brain injury in birth to 5 to 21, and then older than 21. So I know data is being collected and things are happening in the background, but Nancy's right. Call in and ask and share your story. And they keep data on who's calling in and asking about these services as well. So,
well, and I'll point out that one of the ways is that when we first started this, it was at 22. And I was tracking the younger ages. And so we were able, when they decided to lower that to 18, we could go back to the people who had contacted, who we could only refer for innovations and developmental disabilities, and go back and outreach to them again that says the date has lowered. So by having that information, those folks were already kind of connected to us, and we were able to say, hey, this has changed, let's go through. If those folks hadn't called in, we wouldn't know that they were in need. But there is the information of the kids and also just what that prevalence is, because it is a very specific need. It manifests different than some of the other diagnoses. And so it should be acknowledged as such.
thank you. Will the slides be shared? Yes, they will be shared. I will send a follow-up email probably Monday at this point with the slides, a link to the recording. And if there's any other information that John or Nancy want to share, we can share that as well in that follow-up. Next question is, what is the amount that is 300% of the poverty level? What if one is over that amount? Is it possible to reduce SSDI amounts or other income to try to qualify for this program?
So 300% of the poverty is the federal level. I look it up so I make sure I'm current. It's not something that we determine. The criteria and how they look at income is through DSS. Sometimes people have had, in a variety of situations, not just the TBI waiver, have had a spend down, meaning kind of like a deductible. That's all managed through DSS. So I can look up the 300% of poverty for 2023, but it is the federal poverty level.
And that's updated annually, right? Yes, so it changes.
And it is based on that individual. So it is not a family household. It is based on that individual as their income.
And so if they're over 18, oh, okay. Yeah, because they're over 18. So only their income is okay, considered.
That's how the waivers are set up. That individual is that unit.
Yes. Do you see LME-MCO going into prisons to educate those incarcerated about this waiver prior to release?
John?
I could speak to that. Actually, we have developed relationships within Mecklenburg County, and I can tell you that we have been actually, as of yesterday, we did the same presentation to individuals that are working with individuals in halfway houses that are post-release. So yes, we are exploring that, so they are aware of these services. So we're maintaining those connections. So yes, we absolutely are.
Great, thank you. Next question is, how many slots are there? Is it still the original 107 slots?
I don't think, they may have added on additionally, and I've got some questions out to people right now. They may have added on some for Mecklenburg and Orange. Because we've gone into the renewal year, I don't know what the update, so that's what I'm asking as well. But I do know there is not a wait list. There are open slots as of today.
That's good. That's good news. Do you know about how long the paperwork process takes?
It's really not so much as far as our process. It really depends, as I've seen, on where that person is in that injury. If somebody is calling me and they're at an acute stage, they're in the hospital, the records are available, we know what the plan of care is, the timeline. or if somebody already qualifies for Medicaid. But if someone doesn't have the medical history and we have to get the evaluations, or we have to figure out with income and there's all these barriers, that's more on the individual than the process. So it's hard to say a specific time. I know the outreach, once they talk to us, is very quick. I've seen the care managers follow up within days. So that happens. They get folks started to try to see what do we need to do up front and get kind of a status. But I've seen a wide range of what supports people need just to get to that point of getting documentation and evaluated. Or they might be in a facility now and getting that taken care of might be hard.
Great. Thank you.
And I can discuss any of that if there's specific situations. I'm happy to kind of look into that and get people connected and get those questions.
Thank you, Nancy. I found another question in the chat. Just to clarify, if they have IDD, they would go to the innovations waiver services if they qualify.
Yes, if they have IDD. Now, as a child, that can also be considered a TBI would fall under that. So, but if you're talking about an intellectual disability, autism, those kinds of things, that would be the innovations waiver. The entry point is still the same. They can call member services. They'll get information sent. You can talk to me or the staff that are there. So the funnel and the information is the same kind of way. I just encourage people to call and ask questions.
Always ask questions. That's how you
Always
learn.
ask questions. I mean,
Yes.
really, I really try to help over the years to navigate. It's a hard system to enter and just, keep up on. And so I'm happy to do that and try to at least give someone some guidance and some resources.
It's a complicated system. Go ahead, John.
Yeah, I was just going to say, to add to Nancy's comment, from our work within the community, so many times we see situations where caregivers are not aware, have not heard of maybe the waiver. And that's one of the roles that we play, is to be intentional, to really try to connect with our community stakeholders to really get that word out. But we always stress, especially with IDD, earlier the better. We work very closely with the school system and other key stakeholders. But again, just in general, a general rule, time is of the essence with that, because of time, the potential time to get slots. So, we just really would like to encourage, regardless of what MCO LME you're affiliated with, get the ball rolling, get that process started sooner. So that way you get things in motion. So I just want to stress that, just again, it just tends to be a circumstance we see a lot.
Absolutely. Us too.
Christy, I have a couple updates for those questions.
Oh, okay.
There are 57 people currently on the TBI waiver.
Oh, okay.
There are 107 total available across 6 counties. And then as far as the clinical evaluations that are being used, it would be the medical team. So I'm not sure how they're ranging there.
Perfect. Thank you for that update. There's another question in the Q&A. Crystal asked, can someone have too severe of a TBI to qualify?
And it would be yes. A waiver someone has to be safely served in the community as an alternative to a facility level of care. So skilled nursing is the lower level. The neurobehavioral is the higher level. There have been individuals that really need the facility support, or the level of care needed would be beyond the budget and the services that are available to provide. They are community and home. It's a home-based and community-based waiver. So that there is that limit. That's part of that level of care assessment.
So Crystal, I see you raised your hand. So let me see if I can unmute you and allow you to talk, since we have plenty of time. All right, Crystal, you should be able to unmute yourself.
Okay, I guess my question is regarding, we try to help an individual to get on the waiver and he was denied 3 times. And what we were told was because he couldn't communicate well enough. And it's
I'm
kind of very
thinking
severe
there was more.
injury.
Yeah, I mean, I'm happy to get you connected to what, some more information about that.
I guess it goes back to there are, more people are surviving severe TBIs.
Correct.
And if they're going to survive, and stay in their home, they need a lot of services. And
Absolutely.
I can speak for my son. He's 6.5 years out. He was in a vegetative state for 5 years. He can now, talk, eat, and do all kinds of things in the last year
Fantastic.
if they're given a chance. And
Absolutely.
it seems to me that some of reasonings that I've seen were, kind of discriminatory towards the real severe injuries. And there's such a spectrum of, abilities and disabilities
Absolutely.
within TBI. And, where the severe TBI folks, what are they supposed to do? And
Right.
so exactly
And
what
that, I'm sorry, go ahead.
it's just kind of frustrating when you try over and over to help someone, they end up
Absolutely.
passing away and never get to go home.
No, and I would absolutely encourage you to call me and let's talk about this individually. Because these are the kind of situations I'd like to find out more about. With the waivers, the Medicaid waivers, there is a budget that is kind of a maximum allowance that can be served on the community waivers. I don't know if the needs exceed that. I don't know if there were safety concerns, but I'm happy to talk about this one-on-one and just get some more answers for you.
Yeah, I think maybe, so I don't see, so like when I go on the website, Alliance's website, it would be nice to have more specific, information. It would be great to have more open, transparency on qualifying other than just the main staples of
Okay.
checking these couple boxes, because there are, hundreds of people, just like that individual, just like my son, that are they going to qualify or are they not going to qualify? We're not really seeing that side, the more severe side and information at all.
I'm really glad that you brought that up. And I would love to hear more about this. And absolutely, I mean, as we see every day, things change and evolve. And so I think as far as our state, the TBI world is relatively young, although the work has been going into it. We're still in the new stages. And so I would really encourage, you'll have my contact information, my office number and my email, everybody. And I really am happy to take those questions, and for whatever that's out of my role, get you to the people who can get you those answers, which is what I was typing over here. It's when it's not me, I can at least, I like that people respond quickly and get me the answers. I did say, we're in a live talk. I have a few questions.
Thank you, Nancy. Your willingness to be that level of support is just fantastic. I can tell you're a helper. So thank you.
And leading into that, I saw another question, which I thought that was what the question was going to be. The waiver, as it is with innovations, the maximum is still at $135,000 a year.
Okay, for the budget amount.
So many individuals don't need that level. Some are above, but that is what the maximum is for what can be allowable on the waiver.
We have another question in the Q&A. I'm sorry if I missed this piece. What is neurobehavioral level of care?
So neurobehavioral is skilled nursing is much more on the, a lot of times physical rehab, physical occupational nursing types of clinical or professional licensed care. Neurobehavioral is a lot more of the, I don't know what it says. It's the brain and the behavior, a lot more of the mental health, safety, impulsive, occasionally or sometimes can be inappropriate. There are folks that, because of the judgment, may lead to other incidents, and so it's a much higher level of care, much more acute care, but some folks may be even above that level. So again, these are the looking at the higher level of folks. I know we were mentioning about the severe TBIs. These really lean more towards folks that may have the TBI, but have a lot more of the behavioral, mental health types of symptoms and needs.
Great. Thank you, Nancy.
And Christy, I just wanted to mention, and I can provide this to you afterwards, but the direct link to the TBI waiver on our webpage, it does have a host of information, some really great FAQs on there, just other information that would be in addition, to some of the details of what we've provided, but just is there as well. So we want to make sure folks can find it and locate it easily. So I'll make sure you get that direct link
Okay,
as
great.
part of your follow-up. Okay.
We have another question that popped up in the Q&A. What can we do to help our survivors access the rehabilitative care in this waiver not offered in the IDD waiver?
Well, if it's someone who has the adult brain injury, it's to call and get connected to this. The rehab services are not necessarily specific to the waiver. It is something that is done outside of the waiver, the physical therapy, occupational, if that's what you're referring to. But if it's someone who's qualifying, it really is just starting that process and getting that ball rolling. I'm not sure if I'm answering the question.
A follow-up to that, can people in other counties access rehabilitative services and cognitive therapies through IDD waiver?
Innovations waiver for IDD for the intellectual and developmental disabilities. So diagnoses that are lifelong that happen prior to 22, that's across the state. And those are waivers. There's usually an IDD related waiver in all the states. So that's not specific to Alliance. That's just for North Carolina. And that's called NC Innovations.
Yeah, and you can access that through your managed care. IDD waiver is habilitative, not rehabilitative.
Correct.
No cognitive therapies.
In TBI, there is cognitive rehabilitation. Yes, the IDD waiver is a habilitative waiver, which means it's not getting back the skills that were lost by an incident like a TBI. You're gaining skills that may be initially learned. So teaching skills, taking care of themselves, communication, independent living, self-care, those things that may not have ever been acquired. Though that's what the teaching waiver is, kind of how I look at innovations, not just direct personal care. It really is about enhancing those skills. TBI waiver or rehab services are meant to regain the skills that you've lost. If I go to physical therapy because I've torn my ACL in my knee, I'm getting back the strength and the walking. That's rehabilitation. Does that make a little more sense?
Thank you, Nancy. Yes, it does. And Jean, feel free to contact Nancy directly if you have some more questions that are specific to your situation. Those are usually typically better answered, in a more private setting.
A lot of times they're individual situations we can discuss.
True, and sometimes more questions have to be asked to pull out some additional information, and that can get a little personal. Right. One in the chat, there are no rehabilitation services for those with TBI and the innovations waiver.
The innovations waiver is not a rehabilitative waiver. So it's not meant to serve that. That would be served through their medical side. having Medicaid. So a child who needed physical therapy would just be getting that through Medicaid, not on the waiver.
Thank you, Nancy. Okay, I think the Q&A is clear. I think something else just popped back up in the chat. Let's see. The supports intensity scale, I assume that's what SIS stands for, is not normed for TBI with innovations waiver. It's for TBI waiver.
The CIS that they do, again, this might be a specific to a situation. The CIS they're doing to help determine the needs for the innovations waiver.
Perfect. Well, I think that is it for questions. I just want to thank you guys both so much. I know a few of our folks have had to drop off probably because lunch break is over. But we definitely appreciate your time. Thank you so much for joining us today and sharing all of this wonderful information with us. We definitely appreciate it. Again, I'll send a follow-up email by Monday with a link to the recording and a PDF of the slides. Everybody's contact information will be in those slides, and then any other additional information that John or Nancy want to send to you guys. Thank you so much, everyone, for joining us today, and we hope everyone has a fantastic weekend.
Thank you, Christy. I want to mention I sent you that packet for the TBI, and the resources feel free to share with your follow-up email.
I certainly will. Thank you.
If you have any questions, just call me and ask.
I sure will. Thank you so much.
Thanks for having us.
Thank you so
Thank you,
much.
John.